Hi, this is Dr. Candace Harding of Thrive with Dr. C Integrative Physical Therapy, leading you through a spinal stability flow. This should take about 10 minutes, maybe 15 max. Feel free to pause the video anywhere you need to if you would like to slow it down and work on a particular posture. But be gentle with yourself. Know that to find stability will require some effort, but do try to avoid as much as you can gripping through your neck, clenching your jaw or your teeth. Leave this nice and relaxed. We'll start in a tabletop position. Wrists under our shoulders, knees under our hips. If you need to personalize that, make it a little wider, do feel free. The first thing we are going to do is find our spinal neutral, the place where we are respecting the curves that naturally exist in the back, which means a downward angulation at the low back and upward angulation at the upper back. To find it, we'll move through a cat-cow, starting with nice big movements so that you can feel the ends of your range, and then gradually make the motion smaller until you find what feels like the middle. We will repeat that periodically throughout this sequence. So inhaling to lift my gaze, very intentionally tilting my pelvis down towards the floor. Exhaling, round through the back, gaze towards your belly button. Inhale, lift your gaze. Exhale, round. In your own time and pace, begin to make the motion smaller, like I said, until you feel like you've found the middle. Once you've found it, feel like you're zipping up your lower stomach with a tight pair of jeans. You just got to get that lower part of your stomach out of the way. It's a very gentle movement though, not trying to vacuum suck your stomach away, but a gentle drawing in and up at your belly button. With that stability, inhale to reach your right arm up. Exhale, bring your hand down. The goal is to unweight and re-weight without a weight shift. Do this 3 times on each arm. When you're done, if you need to, you can release, reset your spinal neutral. Using your breath. Once you've found it, engaging your pelvic floor and lower abdominal lock, we will now slide one leg out at a time, again, avoiding any weight shifts. Inhale the right leg back. Exhale in. Inhale out. Exhale in. Inhale. Exhale. Inhale left. Exhale. Last time. Inhale right. Exhale. Inhale left. Exhale. Again, release if you need to. A little bit of a twist. Finding your spinal neutral. We will take what I call a down dog prep through to our downward facing dog. So we'll find spinal neutral first, then shift our weight forward and back, gradually sending our hips higher and higher until we're in a downward facing dog. that maintains a little bit of a curve at the low back versus dumping into a curve reversal here. Curl your toes under. Inhale to lift your knees and begin to rock forward, exhaling back. Inhale forward, exhale back. Inhale, exhale. In your own time, to find your down dog. Once you get there, you may find that your knees remain bent in order to maintain that curve, and that would be fine. We're here breathing for 5, 4, nice long spines, 3, 2, and 1. Inhale your gaze forward. Exhale, walk your hands back to your feet. Inhale, halfway lift. Exhale, fold. Inhale, walk your hands forward through a high plank transition. You want to keep feeling your belly button lift up as you're in your high plank. It's not rounding out towards the floor. So here we go. Inhale through high plank. Exhale, my feet forward to my hands. Inhale, halfway lift. Exhale, fold. Inhale to rise up. Lift your gaze, reach your arms. Exhale your hands to your sides, STT. Inhale to your chair pose. Exhale, wrap your left hand to your left low back. Bring your right hand forward to your stomach. So here again, you can feel for your spinal neutral, tipping as far forward as you can, arching back as far as you can. Find the middle. Shift your weight to your right foot. Inhale, lift your left. Exhale, step back to your crescent lunge. We're gonna double check that we stayed in our neutral. Can you tip back any further? Do you have room to tip forward? And then, since you did that and you brought yourself out of it, if you had stayed there, you're gonna find it again. Cool. Once you've found it, inhale your arms high, knitting your ribs in, shoulders away from your ears for 5, 4, 3, 2, 1. Exhale your hands to your hips. Inhale to step forward and wiggle it out. We have to do the other side. Inhale to your chair pose. Exhale, wrap your right arm back, left hand forward, and tip forward and back, finding your neutral. Weight shifts to your left foot. Inhale, right leg lifts. Exhale, step back to your lunge. Checking forward and back that you stayed in your neutral. Once you've established you did, or you found it again, arms reach up for 5, 4, 3, 2, 1. Exhale, hands to your hips. Inhale, step forward and shake it out. Inhale, arms reach up. Exhale, fold. Inhale, flat back. Exhale, high to low plank. Maybe you use your knees. Inhaling up. Exhale your hips high. And shift forward through your high plank to lower all the way down to your belly. 3 rounds of your Shalabhasana or locust pose will engage our stomachs, our lower abdominals and pelvic floor first. So draw in, you should feel your stomach lift from the mat. Shoulder blades onto your back, legs zip together. Inhale to lift for 5, 4, 3, 2, 1. Exhale, lower down. Do what you need to release. Belly draws in, find stability from the front. Inhale to lift. 5, 4, 3, 2, 1. Exhale, lower down. And release. Last one. Belly draws in, lift your pelvic floor, lift your legs, lift your heart. 5, 4, 3, 2, 1. Exhale, lower down. Windshield wiper or log roll. Legs release to the mat. Hands under your shoulders. Inhale, up dog. Exhale to step forward to your back. Segmental bridge. So we're aiming to roll up with one segment at a spine, starting one segment at a time, starting at the lowest portion of our spine. And then once we're up, reversing the direction, lowering down with the upper segments before the lower segments. Most of the difficulty will be in this lower portion of your back. You'll really want to use that drawing in and up sensation from your pelvic floor to help create that last bit of a roll, so you're not getting your bottom down before your low back. I recommend maybe pausing the video, setting a timer for 2 or 3 minutes. You take your time, do as many as you can, not rushing. Taking breaks whenever you feel like maybe things are fatiguing, or if it's fatigued and it's not getting any better, you rested, then you're just done with your segmental bridge for the time being. You might revisit it later in the day. So make sure you can press your heels with your fingertips. Draw in and up at your pelvic floor, initiating the motion from our pelvis as we inhale to lift. Keeping in mind, the higher you go, the lower you have to come on your way back down, so more work. Really taking your time. Sometimes sound effects help. Inhaling up, exhaling. One segment at a time, back down. When you're ready and done with your segmental bridge, find a Supta Baddha Konasana with the soles of your feet touching, knees open wide, one hand on your heart, one hand on your belly. Nice long exhales to help calm and settle your system. Stay here as long as you like, or maybe you find a shavasana. Thanking yourself for your time on your mat. Thanking you for following along.